Well, your thyroid gland controls a lot of extremely important functions in your body, from your metabolism to your heart and digestive function, even muscle control and brain development. It's an important part of your everyday health. And unfortunately, millions of Americans find out every year that they have a thyroid problem. So Dr. Daryl Willett joins us now from Ohio ENT and Allergy Physicians to kind of help us better understand it. So I want to thank you for being here, Dr. Willett.
Thank you, Robin. I appreciate having the opportunity to talk to your viewers today about thyroid nodules and thyroid cancer. But before we get started...
Yeah, let's get a little anatomy lesson because we need to know where it is, what it is.
Absolutely. Now, your thyroid gland is located in the front part of your neck here, and this model represents your voice box region. You have your Adam's apple, your trachea or windpipe, and your thyroid right here. So it looks like a little butterfly in your neck, and this is pretty normal size for a thyroid. Now, many people ask me, what's a goiter? Well, a goiter is represented by this picture right here, and it's an enlargement of the thyroid gland, and it represents a benign process.
Okay, so that is something that we're going to get into because a lot of people hear of the issues they have with their thyroid. Thyroid nodules are pretty common. So what is that?
Right, very, very common. It's just a growth in the thyroid gland. It can be benign or malignant. And if I were to offer all the viewers an opportunity to come in here and just let me palpate or feel their thyroid gland, 5% of women in the general population have a thyroid nodule that's palpable. Now, if we went one step further and offered a screening ultrasound to all your viewers, up to 20 to 60% of just random screenings can have a thyroid nodule.
Wow, that is, it's, I guess, surprising to learn that many people could have an issue and may not even know it.
Right. Fortunately, there's folks like us that can take care of them.
Exactly. That's what you're here for. So let's talk about going a step further. Thyroid cancer. How common is that?
Well, so many of the patients come in and they're fearful that they have thyroid cancer, but I reassure them that 5% of all nodules represent cancer. So please understand, 95% are benign. But if you look at studies back in 2009, 37,000 new cases of thyroid cancer were picked up in the U.S. Now, go 5 years in the future, 2014, 67,000 new cancers. And they predict by 2019, it may represent the third most common cancer in women, surpassing colorectal cancer.
And do we know why it seems to be on the rise? Is it better screening?
Well, yes, it's probably just a misconception that we have that is becoming more common. If you take a look at some of the technology that we have, if you have neck problems and you go get an MRI scan, they may incidentally be able to pick up a thyroid nodule on that MRI scan. And years ago, they wouldn't have seen that because the technology is so awesome now. And CAT scans have gotten better. And Doppler studies of the carotid artery, look at blood flow for stroke victims, has gotten better. So they incidentally pick these up and probably not necessarily on the rise.
Is there a way to, I guess you said you can screen for this. Is there a blood test? I mean, how can you find out if you have a real issue?
Right. You know, so often patients come in, they're upset because their family doctor, their primary care doc didn't find this cancer that they have because I have blood work done every year. Why didn't they see it? Well, unfortunately, thyroid's not like prostate cancer or colon cancer, ovarian cancer, where the tumor secretes a marker that you can tell whether they have it in their bloodstream. You have to actually palpate the neck, do ultrasounds, maybe needle biopsies.
Now, what would qualify kind of a concerning characteristic for somebody? If they're sitting there saying, yes, I have these neck problems, is it something serious?
Right. If I feel a nodule that's hard as a rock, that bothers me. If I find that a patient has a certain particular hoarseness, and those of us that are in the field can pick up that particular hoarseness that's suggestive of maybe a vocal cord paralysis, or if they come in with an ultrasound and I review that and I see little tiny calcifications on there, that might make me suspicious as well.
Now, you mentioned women, more common in them. Is that the case with this?
Yeah, absolutely. And, you know, unfortunately, you gals tend to get a lot of things with your thyroid. And so we're a little bit more on the exam side. OBGYN doctors are picking up on this, and so it's just more common with them.
Now, as far as treatment, if somebody does get the diagnosis, they have thyroid cancer, what is kind of the treatment plan for that?
It's very simple. Surgery is the mainstay of the treatment for thyroid cancer, followed by radioactive iodine, which is a very simple. You swallow a capsule and it takes care of any metastatic disease you may have. There is no chemotherapy or radiation therapy for this, so it's actually very simple to treat.
So you want to go get it checked out, get it screened, because it is kind of a more simple way to get rid of it, and you want to be safe.
And very treatable.
All right, I want to thank you, doctor, for being with us.